This is the Aronite fact sheet about risk assessment. If you would like further information, please call us on 0207 947 9581 or visit our website at www.aronite.co.uk. The Health and Safety Executive defines a risk assessment as a process involving the identification of hazards arising out of work activities and evaluating the extent of the risks involved, taking into account the existing precautions and their effectiveness. A hazard is defined as something with the potential to cause harm, which includes substances, equipment, methods of work, the work environment, and other aspects of work organisation. A risk is defined as the likelihood of potential harm from a hazard being realised. The Health and Safety Executive outlines 5 steps to risk assessment that employers must follow. Firstly, identify the hazards. Then decide who might be harmed and how. Then you need to evaluate the risks and decide on the controls, and record and implement your findings. And finally, you must ensure that you review and update your risk assessment if required. So what is the typical risk management process? Common hazards include manual handling, slips, trips and falls, driving for work, heavy computer use, fire, hazardous substances, and work at height. The resulting harm covers injuries and ill health and may affect a range of people, including employees, inexperienced staff, visitors, customers, and contractors. Examples of risk control measures include employee competence, working procedures and guidelines, personal protective equipment, emergency procedures, and good work equipment design. The flow diagram shows the simple process of risk assessment. The risk assessment of a work activity is simply broken down into the hazard, the harm, and the control measures. There may be several hazards involved in one work activity. You need to record the findings and, most importantly, inform those at risk of protective measures. And the way that you can do this is through working procedures, training and information, and by the use of method statements. And finally, you need to review if there is a change that affects the level of risk. The risk evaluation process can be quantified. This is done by multiplying the probability against the severity of an event. The probability is broken down in this example from certain, likely, possible, unlikely, and rare, and the severity is broken down into fatal, major harm, serious harm, minor harm, and no harm. These factors are placed in the matrix, and you are then able to decide whether the risk is high, medium, or low. For high risk, risk control measures must be implemented to reduce the risk as low as is reasonably practicable. Action to reduce the risk should be given top priority with senior management involvement. If the risk cannot be reduced, work should be stopped. For a medium risk, cost-effective risk control measures should be implemented to reduce the risk to a level that is low as is reasonably practicable within a reasonable time. And finally, for a low risk, the risk is considered acceptable and no additional risk control action is normally required. Cost-effective risk control measures may be implemented to further reduce the risk with lowest priority. Should you require further information about these fact sheets, please contact Aronite online or by phone.